A very warm good morning to one and all, respected ma'am and my dear friends. I am Ms. Himali Pathak, a student of BSc Nursing second year, roll number 18. Today, as a group from roll number 11 to 20, we are going to present one seminar on the topic coronary artery disease. So, uh, let me introduce what is coronary artery disease. Okay, so let us know what is coronary artery disease. Okay, so coronary artery disease are the type of heart diseases affecting mainly the coronary arteries. Coronary arteries are actually those arteries which supply blood and oxygen to various parts of our heart. Okay, so in our body, as we can see in the picture I have shown, there are generally three major system of coronary arteries. So one at the front is the left anterior descending artery, and in one at the right, it in the lower part of the heart, that is coronary right coronary artery, and the another one is circumflex coronary artery, which supply to the lateral side. Okay, so uh, then like these arteries with time and with risk factors, this may be deposition of, means there may be some deposition of cholesterol or lipids like fatty tissues. So those deposition cholesterol material inside the artery within time and with the presence of risk factors like hypertension, high blood pressure, diabetes, aging. There are so many factors. I'll not tell you in the details, as my friends they are going to explain. So let us there is some progression on buildup of the cholesterol deposition inside the arteries. When there is large amount of deposition of cholesterol in the arteries, it leads to the narrowing of the lumen. When our lumen is narrowed, the vessel is narrowed, then it result in the obstruction of the blood flow to the heart. So if there is obstruction in the blood flow, then we know automatically it will rise our blood pressure. So this can present with the various symptoms, and other something causes heart attack. Okay, sometimes it causes also heart attack as our uh, arteries are blocked, so there will be no oxygen supply, so it will lead to heart attack. Okay, so when the artery is completely blocked, when our artery are completely blocked or obstructed, this condition are commonly refers as coronary artery disease. So now coming to the definitions, definition given by Joyce and Black. So as he told, like coronary artery disease result from the development of atherosclerotic lesion within the coronary arteries that narrows or obstruct the vessels. Okay, so when there is development of atherosclerotic lesions, that is development of cholesterol, so within the coronary arteries which narrows or obstruct the vessels, that is leads to coronary artery disease. Okay, coming to the next definition, coronary artery disease is a condition where there is an abnormal accumulation of lipid or fatty substances and fibrous tissue in the vessels wall, creating blockage or narrowing the vessels, thereby reducing blood flow to the myocardium. It's given by Burner and Chadharts. I'll tell you, in conditions where there is abnormal accumulation of fatty substances or lipids, fibrous tissues in the vessels wall, which will create blockage or narrowing to the vessels. So when there is narrowing or blockage to the vessel, there will be less blood flow to the myocardium is our heart muscles. So there will be less oxygen supply, and which will lead to coronary artery disease. Okay, so coming to the next definition given by Linda and Paula. So coronary artery disease is a term applied to the obstruction blood flow through the coronary artery to the heart muscles. Okay, it is same like when there is obstruction, so it will lead to coronary artery disease.
Hey everyone, my name is Hariniglu, roll number 16. Today I'm going to explain the anatomy of coronary artery disease. This is the anterior view of the hand. The aorta. The aorta has supplied with the rich oxygenated blood, and from this aorta, it comes the left coronary artery. And this left coronary comes from the aorta, and it branches off into the circumflex arteries. Circumflex means around the left coronary artery, and this artery comes from the heart, and it provides blood to the left atrium and side and back of the left ventricle. The left anterior descending artery. This provides the left anterior descending artery. This provides blood to the front and bottom of the left ventricle and front of the spectrum. And the right coronary artery, it branches into the right marginal, and this supplies blood to the branches of the right ventricle. The main goal of the right coronary artery is to provide blood to the right atrium and ventricles and to the bottom of the path of the left ventricles and back of the septum. The collateral circulation. The collateral circulation is the tiny blood vessels formed to reroute blood around the blocked artery. When the person has a chronic ischemia, chronic blockage, the heart will actually try to round circulation around that blockage so it can give blood to the heart muscle.
Risk factors of coronary artery disease. Non-modifiable risk factors are those risk factors which can change. Modifiable risk factors are those that we can reduce the coronary artery disease. Non-modifiable risk factors are age. In men who are more than 45 years old and in women who are more than 55 years old are increased risk of coronary artery disease. Family history. Genetics play an important role in heart health. If the parents and grandparents had coronary artery disease, then the children also have high risk to have coronary artery disease. Race. Non-white people from the African descent are increased risk of high blood pressure. Therefore, the actual risk of coronary artery disease and also some as South Asian, they has independent risk factor of cardiovascular disease. Now come to the modifiable risk factor. High cholesterol level. If the person have high blood cholesterol, especially the LDL is known as bad cholesterol, that LDL will start depositing in the blood vessels over time, and that will block the vessels causing CAD, coronary artery disease. High blood pressure. Especially when the person have high blood pressure, the blood is passing through the vessels with very strong force, so this will damage the blood vessels, and the damage are attract the cholesterol and inflammatory marker, leading to the formation of clot. Diabetes mellitus. The high blood glucose that also made the blood vessels stiff over time and damage them, and again the flag is formed at the damage, which can block and causes coronary artery disease. Cigarette smoking. They also damage the vessels and narrowing of artery and leading to heart attack. Physically inactive. If the person is physically inactive, it will make them obesity. Obesity. If the person is obese, it will lead to self in risk factor of diabetes mellitus, hypertension, high cholesterol level, which lead to coronary artery disease. Other risk factors like high level of CRP, lipoproteins. Second one is end-stage renal disease, connective tissue disease, HIV. And third one is low serum testosterone.
Pathophysiology. Chronic endothelial injury of the arterial lining. Atherosclerosis is the major cause of CAD. It is characterized by lipid deposits within the intima of the artery, and endothelium is the inner lining of the vessel wall, and it is injured, and it leads to the inflammation of the atrial wall, and lining can be injured as a result of tobacco use, hyperlipidemia, hypertension, toxins, diabetes, and infection causing a local inflammatory response. Fatty streak within the intima of the arterial wall. Fatty streaks, the earliest lesions of atherosclerosis. Atherosclerosis is the buildup of fatty cholesterol and other substances in and on the artery walls. Are characterized by lipid-filled smooth muscle cells. As streaks of fat develop within the smooth muscle cells, a yellow tinge appears. Fibrous plaque formation. Fibrous plaque formation. The fibrous plaque stage is the beginning of progressive changes in the endothelium of the arterial wall. These changes can appear in the coronary arteries. This leads to the proliferation of smooth muscle cells within the vessel, and that leads to the formation of fibrous cap over that fatty core. That means atheroma. Atheroma is the fatty material which forms deposits in the arteries. Profusion, that leads to the profusion of atheroma into the lumen of the vessel, and that leads to the narrowing and obstruction of the arterial wall, which leads to the rupture of lipid core. This leads to thrombus formation, and thrombus formation leads to the sudden cardiac death due to obstruction of blood flow, and this leads to the myocardial infarction. Myocardial infarction is a blockage of blood flow to the heart muscle, which we can call as heart attack. Now coming to the clinical manifestation. In clinical manifestation, we can show substernal chest pain radiating to jaw and hand, and diaphoresis. Diaphoresis refers to excessive sweating with no clear cause. After that, shortness of breath, then dizziness, nausea, and vomiting.
For diagnostic evaluation for CAD patient, that is coronary artery disease patient, we need history collection, then physical examination, cardiac enzyme, electrocardiogram, echocardiogram, stress test, nuclear imaging, and angiography. Coming to the surgical management, we have percutaneous transluminal coronary angioplasty. Okay, in short form, it's called PTCA. It is a technique in which balloon tube catheter is inserted into a blocked coronary artery, which means that the balloon is inserted to the coronary artery, which is already blocked. Why the balloon is inserted? The balloon is inflated several times to rehab the lumen by stretching it and flattering the atherosclerotic plaque against the arterial wall, thus opening artery. Okay, the implant static left in place, low molecular weight heparin is given in conjunctive to PTCA to maintain open vessel. Why heparin is given? Heparin is given to prevent clotting of blood. Then number 2 is directional coronary atherectomy, DCA. The DCA cutter consists of a catheter that contains a rigid cylindrical housing with a central rotating blade. The blade shape of the atherosclerotic material and deposit it into the nose concentration of the housing, that is the outer compartment. The number 3 is myocardial revascularization coronary artery bypass graft. In short form we call CABG. A procedure used to increase blood flow and oxygen to the myocardium and alleviate anginal symptoms during bypass surgery. A blood vessel from the leg or chest is used to revolt blood around a segment of coronary artery that is narrowing by atherosclerosis. Now for management for CAD patient, medical management. Coming to the medical management first, we will talk about drugs and action. First drug is nitrate. This nitrate, they are the anti-anginal. And number 2 is acetylsalicylic acid. Example of this is ecosporin. This it is ACA blocks prostaglandin synthesis. This action is used to prevent platelet aggregation. Okay. Then number 3, it is anti-lipidemic agent. This anti-lipidemic agent, it will come like HMG CoA reductase. It inhibits 3-hydroxy-1,1,3-methyl-glutarate, okay, enzyme. And 4, it will come statin. Statin, what it is to do? It is to inhibit synthesis of LDL and VLDL, okay. And 5, it will come bile acid sequestration. Here it is to bond with the bile acid and help in removing LDL and cholesterol. And number 6 is fabric acid derivative, okay. Then after that, what is fenofibrate? Fenofibrate, it is to decrease hepatic synthesis and secretion of VLDL, okay. Coming to the surgical management, we have percutaneous transluminal coronary angioplasty, okay. In short form, it's called PTCA. It is a technique in which balloon-tip catheter is inserted into a blocked coronary artery, which means that the balloon is inserted to the coronary artery, which is already blocked. Why the balloon is inserted? The balloon is inflated several times to rehabs the lumen by stretching it and flattering the atherosclerotic plaque against the arterial wall, thus opening artery. Okay, the implant static left in place. Low molecular weight heparin is given in conjunctive to PTCA to maintain open vessel. Why heparin is given? Heparin is given to prevent clotting of blood. Then number 2 is directional coronary atherectomy, DCA. The DCA cutter consists of a catheter that contains a rigid cylindrical housing with a central rotating blade. The blade shape of the atherosclerotic material and deposit it into the nose concentration of the housing, that is the outer compartment. The number 3 is myocardial revascularization coronary artery bypass graft. In short form we call CABG. A procedure used to increase blood flow and oxygen to the myocardium and alleviate anginal symptoms during bypass surgery. A blood vessel from the leg or chest is used to revolt blood around a segment of coronary artery that is narrowing by atherosclerosis. Now Number 4 is transmyocardial laser revascularization. Transcardial laser revascularization, it is an option for patients who are not candidate for angioplasty or coronary artery bypass surgery. Carbon dioxide laser revascularization uses a high-power carbon dioxide classes to create 40 transmural channels directly into myocardium. The classes is synchronized to fire on the R wave of the ECG. This minimizes this rhythm and ensures that the ventricles is at rest full of blood. The channel create allow blood to flow into the ischemia area. This enables oxygen-rich blood to flow directly into the ischemia myocardium. Now, coming to the nursing management, number 1 is assessment. Okay, the nurse gather information about the symptom activities in PQRST form. First, she have to look the ECG report, especially those that present and precipitate attack of angina pectoris, risk factor, patient and family understanding of CAB, then ECG, vital sign, and report of LDL level and evaluation of other medical condition. Coming to the nursing, diagnostic and intervention. First, we have acute pain related to imbalance oxygen supply demand resulting from coronary artery occlusion as evident by pain. What are the intervention? The intervention we have to assess characteristic by pain location, duration, quality, and intensity. Then by using pain scale, ECG monitor, then vital sign, administer morphine, then monitor drugs response. Then number 2, ineffective tissue perfusion, ineffective tissue preference related to occlusion by thrombus in coronary artery, evidenced by ST segment illusion. That is ineffective tissue preference related to occlusion by thrombus in coronary artery, evidenced by ST segment elevation. Okay, we have to administer humidify oxygen, then keep client in semi-fowler position, then monitor vital sign, then administer drugs aspirin thrombolytic as order, then monitor ST segment changes. Number 4, coming to the decrease. Number 3, it is decrease cardiac output related to negative in atropine changes in the heart secondary to myocardial ischemia. Okay, that is decreased cardiac output related to negative in atropine changes in the heart secondary to myocardial ischemia. We have to assess mental status, then monitor the vital sign, maintain input output chart, then monitor EBG, then administer B blogger and prescribe. Deficient knowledge related to ineffective management of regimen for others sclerosis or coronary artery disease. Here we have to identify factors that will inter with the patient's ability to desire information. Then include significant others as appropriate to support patient during burning. Then determine cultural belief as they may influence learning. We should use appropriate teaching tools to meet individual learning needs of the patient. Explain the pathophysiology of atherosclerosis and CAD to patients so that the patient won't get anxiety or won't feel scared. Okay. Then explain to patient how to control risk factor and manage symptoms of CAD. The lifestyle changes. Here, what are the lifestyle changes that we should modify? Weight control, then smoking cessation, regular physical exercise of moderate level, and heart healthy diet like low fats, low sodium, then stress management. Okay.
So, coming to the conclusion, coronary artery disease is one of the leading causes of death in India. Okay, in our India, heart diseases are very common. It occurs, coronary artery disease occur to the occlusion of coronary arteries by the atherosclerotic plaque formed within the human of the coronary artery. Okay. so it which will like thereby obstruction will be there, there will be less blood supply to the heart. Okay, so we are coming to the end of our topic. So are you clear with coronary, what is coronary artery disease, how it occur, how everything, are you clear? So thank you all, thank you ma'am for your valuable time, and thank you everyone for your cooperations. As you all know, why coronary artery disease occurs. It occurs due to the deposition of fatty tissues, so in the artery. So if there is deposition, there will be formation of an atherosclerotic plaque which will obstruct our arteries, like which will obstruct the blood flow to the heart muscle, and it will lead to ischemia or heart attack. So if there's complete blockage, there will a chance to lead to heart attack. Okay, lifestyle is a very important factor. uh, as we Indians, we eat very oily food, so due to this also in India there is more occurrence of heart diseases. Okay, so are you clear with this topic?